This episode of the Beauty by ABIC podcast is brought to you by Mara Aesthetics. Hello and welcome to the Beauty by ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we are strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is Beauty by ABIC. I'm your host, Stephanie Miller, and today's guest is Dr. Guido Maronati for Mara Aesthetics. Dr. Guido graduated in medicine and surgery from the University of Milan in 2000. In 2001, he qualified to practice as a medical doctor after passing the Italian Medical Board qualifying exam and is registered with the Provincial Order of Physicians and Surgeons of Milan. In 2001, he became the winner of the concourse to attend the School of Specialisation in Plastic and Reconstructive Surgery at the University of Udine. In 2006, he completed his specialty training in plastic, aesthetic and reconstructive surgery and spent a year in Brazil undergoing intense training with the famous surgeons Dr. Professor Ivo Pitanguy and Professor Antonio Robert Bozola. Since 2013, Dr. Guido has been using Aptos Threads, which are gaining worldwide recognition and are successfully applied by specialists in more than 80 countries. Having become the first Italian expert in Aptos trainers in 2017, he now travels around the world as a speaker and trainer. He is a member of the Italian Society of Plastic, Reconstructive and Aesthetic Surgery and a member of the Italian Society of Plastic and Aesthetic Surgery. Here to share his knowledge and expertise in electrical arc, sublimation therapy, and the East HP system for Mara Aesthetics. Today we welcome Specialist Plastic Surgeon Dr. Guido Maronati. Welcome to the podcast, Dr. Maronati. How are you?
I'm very fine. Thank you very much. I'm very happy to stay here with you today.
Well, we're very excited to have you on the podcast today. I tell you what, we're going to pick your brain, your expert brain today, and find out all about the wonderful technology and devices that you're using and everything that you're doing in your practice. But before we start, you are renowned in your field. You have a great story on how you came into this industry. Dr.
Yes.
Guido, tell us about yourself.
Yes, great. Look, my name is Guido Maronati, and I'm an aesthetic and reconstructive plastic surgeon from Italy. Now, I'm working in Milan. I'm working in Monza, that is a small city very close to Milan. I'm working in Switzerland, and now I'm traveling all over the world in many, many countries for trainings. And one of my passion, of course, is the aesthetic surgery, and is one of my important field. The most request surgeries in Italy are blepharoplasty, breast augmentation, breast reduction, liposuction, tummy tuck. And another field that I'm working is the aesthetic medicine, so all the treatments in aesthetic medicine. And another very important field is about the laser therapies, the technologies, the new devices. So I have a lot of interest about these all new technologies. Talk about the East HP, that is a very important and interesting device.
And you do so many things. I mean, you go from surgery, so surgical interventions, to non-surgical as well interventions, and you blend the two so seamlessly. Could you tell us a little bit about your practice? You know, what's the philosophy of it? Because that intertwining of the two is so special, and specifically what areas you like to focus in within your practice.
Yes. Well, I think it's very important for our job not to be able to do only one thing, for example, only surgery, only aesthetic medicine, only devices, because most of the times our patients are asking a lot of things. So for my point of view, it's very important to be able to know a lot of things and to suggest every time the best indication and the best therapy for every patient. So usually one of my first passion is the treatment of the face. And so, for example, I love to combine surgical techniques and non-surgical techniques, for example, for the rejuvenation of the eyelid or of the nose or the face, of the quality of the skin. This is of my passion. And from my point of view, it's easier to combine these things in the face. Because, for example, when we are working in the body, one of my second passion is the breast, so the breast augmentation, breast lifting, breast reduction. In this case, it's not so easy to work with devices in this area. So usually, from my point of view, in the body, I'm usually do surgery, the classical surgery. In the face, it's easier to combine not only surgeries, but treatments about aesthetic medicine and using very kind of devices.
I love what I'm hearing, and I'm sure people are very intrigued listening to your philosophy, especially when you mentioned blepharoplasty. So you're talking about eyelid surgery, but also in combination with non-surgical interventions as well. Give us an example. What would you do?
Yes, for sure, because the problem is that many times it happens that we can have patients refusing surgeries, for example, or maybe we can have patients that want to do surgery, but they can't afford the surgery. Why? Can be, for example, for health reason, for medical reason, because maybe they can have any kind of problem with heart, with brain, with something, or maybe because they don't have enough money to afford the surgery, or maybe because they are afraid of surgery, maybe because they don't want a long recovery time, they refuse scars. So I think that for us, it's very important to have always a second alternative. So depending by the request of our patients, every time we can suggest the best therapy. And sometimes this therapy can be a surgery, and sometimes this therapy can be something different.
Mm.
Important thing for me is never to transform a patient in another patient. So for me, it's very important that every time we decided to work with our patients, our goal has to be to have an improvement of the quality of the skin, an improvement of wrinkles, an improvement of everything, but always without changing too much our patient. This is a very important thing for me.
Oh, I love what you're saying. And that leads us right into the topic, the strong topic for today. And this is new technology that we're hearing about everywhere. It's really exciting. And it's called East HP.
Yes.
Dr. Guido, tell us, what is it and how does it work?
Yes. Look, the East HP is a medical device used in aesthetic medicine. And it means electric arc skin thermoabrasion high performance. So what exactly is an electrical arc sublimation therapy? An electrical arc is a natural phenomenon that we can observe in nature that happens when an electric circuit opens or closes. So it's a light channel produced by the ionization of air that therefore becomes a conductor, a plasma. And this medical device is able to generate an electrical tension defined and controlled that can produce an electrical arc between a point that our case is the source of energy and the skin. So every time we can have a controlled sublimation or vaporization of dermoepidermal junction with limited damages to derma and hypoderma. This is very important.
Wow. I'm trying to get my head around it. It sounds incredible. When would you use this technology instead of or in conjunction with surgery?
Yes, look, for example, we can use the yeast instead of surgery. For example, when we have patients with skin damages, when we have patients with, and we want to do a skin contraction blepharoplasty, but in non-surgical way, we can use it, for example, in patients refusing surgery for all the things that we discussed before, Or we can use this device, for example, in patients that are looking for some mini invasive procedures and they don't accept the surgery. And what about, for example, the most common conditions that we can treat with yeast? Of course, one of the most requested is, without any doubt, the non-surgical blepharoplasty. And we can treat, for example, people with eyelid skin excess. We can treat people with eyelid wrinkliness or with crow's feet wrinkle. And we can remove with this device dermal nevus, we can remove pedunculate verruca nevus, we can treat seborrheic keratosis, we can remove xanthelasma. Xanthelasma, for example, is very common. And the problem of xanthelasma is, even if you do in the classical way with surgery, it's very, very common that you can have xanthelasma again after a few months. So we have the possibility, the chance to use this important device to remove the xanthelasma with no side effects. We can treat telangiectasias, we can treat the barcode, for example, we can treat scars, we can treat lentigo. So as you can see, the indications are a lot. We can do a lot of treatments with this important device.
That's incredible. And tell me a little bit about, you're talking about scarring. I'm assuming it would work amazingly well on stretch marks as well.
Yes, it works very, very well. And you know that sometimes the problem of scarring is very important, because what we see in our practice is that every time I'm doing a scar in my patient, the scar is always different. So even if I'm always the same, even if I'm always using the same technique, the same stitches every time, I will have a different scar. Why? Because the scar, it depends by the quality of the skin of the patient, and it depends by the patient every time. And what about stretch marks? Stretch marks are very, very difficult to treat, and we don't have a surgical solution for stretch marks. So, for example, the yeast technology can be a very good option to treat scar and stretch marks, which is the only difference that when we use this device is that, for example, when we want to treat very fine wrinkles, we will use a very low power because we don't need a lot of energy. At the opposite, if we need to try to treat, for example, very big and important hypertrophic scars or keloid scar or very deep stretch marks, in this case, it's very important to use a high energy. And this is good because even if we are using a high energy, we don't have the risk to have side effects, for example. So it's very, very common to use the yeast to treat the scar and stretch marks too.
And what are the results? You know, it sounds like such an incredible technology. Are there side effects and contraindications?
Yes, look, about the side effect, I can tell you that usually we don't have very important side effects. Why? Because we are doing a skin vaporization, but without an extended deep diffusion. So usually it's very, very uncommon to have side effects. I think that from my point of view, the most frequent side effect is the edema, is the swelling that we can have sometimes in our patients, or can be a redness that we can have for a few days. And these are the only side effects. And what about the contraindication? I think that more or less we don't have any kind of contraindication for this device, but we have two important limits from my point of view. The first limit is the presence of eyelid fat pad. As you know, the fat pad in the eyelid are under the muscles. And with this device, it's really not possible to work under the muscles because I'm working only in the junction between the derma and the epidermis. So, for example, if I have patients with very important fat pad, it's really not possible to treat them with yeast. So in this case, I need to do the classical surgical blepharoplasty. The second is when I have patients with very important and severe blepharoptosis, because as I told you before, this device is very good to give a skin retraction, skin tightening, skin vaporization. But of course, if I have a lot of skin, it's really not possible to treat it completely. So from my point of view, these are the only two limits. But if we talk about contraindication, to tell the truth, I don't think we have any kind of contraindication.
That's amazing. So any person is suitable for this treatment, really, besides the I suppose limitations, as you call them. I like that you use that word. Those two limitations. That's really incredible. The average person will be able to have a treatment, say on their eyelids, and how long would they have to kind of take off work for downtime? What's the
Yes,
length?
yes. Look, the first thing to say is that this treatment is very, very fast. So usually, for example, when we do the non-surgical blepharoplasty, usually we need between 3 and 4 minutes each eye. So the procedure is very, very fast. And the downtime, I think, is very important for our patients. And most of the time, it's very important to discuss about the time with our patients.
Of course.
Not every patient can accept a very long downtime. So usually, if we compare the downtime of a blepharoplasty made by yeast and the classical blepharoplasty, we have a very big difference, because usually the downtime can be just a few days.
Since 2010, Mara Aesthetics has provided Australian and New Zealand clients with state-of-the-art, cutting-edge products in the field of minimally invasive cosmetic surgery. Mara Aesthetics is committed to adding value to their clients by providing products and services that produce exceptional, natural aesthetic results whilst ensuring patient satisfaction. With a focus on training excellence, their dedicated training facility, South Pacific Cosmetic Academy, is an integral support arm for their products and services, providing their clients with the ability to achieve superior patient outcomes. To learn more, visit www.maraaesthetics.com.
Of course, we have to consider that with this device, we have the possibility to use different levels of energy. So if I will use a low energy, the downtime usually is 24 hours, maximum 48 hours. So in 1-2 days, the patient is perfect, okay? And after 48 hours, our patients can do any kind of makeup. So the downtime is very, very short. At the opposite, of course, if I want to treat a very deep scar, a very hypertrophic scar, of course, in this case, I need to use a very high level of energy. So in this case, the downtime can be 5 or 7 days, more or less.
And what does it look like? You know, give us an idea. I've had a blepharoplasty with East HP. What would I look like? Would I be swollen? Would I have, you know, the typical little dots on my eyes from a plasma device?
Yeah, of course, as I told you before, is very, very important, the choose of the power. So if you use a low intensity of energy, you won't have a lot of things. But usually what we have, we can see some dots, some points due to the skin. We can have a very, very little edema, little bit swelling, and we can have a small redness. But we can cover all these things with the makeup just after 48 hours. So usually I tell to my patients that the really important downtime is just a couple of days, because after a couple of days, you can do all the things that you want. And we have of course, to use sunglasses to protect our eyes. So usually we are able to come back to our social life in a very short period.
Oh, that's wonderful. There are so many devices that claim to do a similar thing on the market, but there are limitations with some of the other devices. Tell us a little bit about, you know, what are the advantages of choosing East HP over, I would say, similar but not so similar devices on the market?
Yes, you are completely right, because as you know, in the market, we have a lot of devices, but more or less similar to East. So which is the first important difference? Similar devices, they do a skin vaporization, but with a very important extended deep diffusion. So they can have a lot of side effects, and they able to work only at the surface. They are working in the deep tissue. And consider that yeast nowadays is the only instrument in the world with a duty circle system that can be modulated with splitting of the signal in frequency. So this device has a radio frequency generator, and this is the only one that has a radio frequency generator, and it's able to give better results to our patient and with less dermal damage. This is very, very important.
Mhm.
So we have less heat input on the skin.
Do you control the amount of heat that is applied into the skin, or does the device control that?
No, yes, we can control it because on the device we have a button and we can choose 10 different levels of intensity.
Wow.
So every time I can choose the right intensity to my patient. But even if I'm using the powerful one, so it's from 1 to 10, so number 10, even if I'm using this important power, if the device has a system then controls the energy. So it's really not possible to work too deep. So even if I'm using it in a strong way, I will never give a very deep damage to the tissue of my patient.
That's very different to a lot of devices on the market. That level of precision and that level of control that you have is quite appealing, because, as you know, using these types of new technologies, sometimes if there isn't that control, you can encounter issues. One thing that I'm very curious about is we've talked about upper face. What are the results on your lower face, for pre-jowl,
Yes.
skin laxity around the lower face, people that have, aging or have lost a little bit of weight or something like
Very
that?
interesting question. Look, in these days, we did a very interesting training with doctors from here, and we did a lot of treatments. So this device usually is used for the upper blepharoplasty because the upper blepharoplasty is most recasted. But for example, we can treat the wrinkles and the skin laxity of the lower eyelid exactly in the same way we're treating the skin laxity of the upper eyelid. And for example, we can treat the barcode. The barcode is very difficult to treat. I know that many doctors are using a lot of fillers with hyaluronic acid, but then the result is not so natural, because at the end you have your lips that are very big and the barcode that is full of hyaluronic acid, and the result is not so natural. So for example, the barcode is possible to treat with yeast, and we can work in all the vertical wrinkles that we have in the barcode. Another area that sometimes we treat, and during this training we treat so much, is the area very, very close to the ear. Because sometimes when we are getting old, we have a lot of excess of skin very close to the ear in the preauricular area. And it's possible to have a skin tightening of this area just very close to the ear with very, very good result. So more or less, we can treat any kind of part of the face. The jawline, it depends by the patient, because if we have, it's a difficult area to be treated, but we have a patient with a very thin skin, we can treat. At the opposite, we can't treat. Why? Because all the times that we have a skin very thin, the chance to have a skin tightening is very high, is very good. At the opposite, if I have a skin who is very thick, it's very difficult to have this kind of retraction. So it's impossible to treat even the jawline, but only in patients with thin skin.
What about an overall facial rejuvenation? Could you, with this device, treat a full face all at once?
Yes, yes, for sure. I show a video in these days while I was treating a full face treatment in one man patient. And with this device, we have other two different tips, and we are using the radio frequency generator of the device to treat all the surface of the skin. So we can do a full face treatment, we can treat the neck, we can treat the neck. And another thing that we can do is, for example, to apply on the surface, on the skin, some product, for example, with the peptides or maybe hyaluronic acid. And with this particular tip generated by the radio frequency, we can treat all the skin without any problem. And we can have a very good rejuvenation of the skin. So even in patients with a lot of pigmented lesions. So, for example, as you know, when we are getting old, we have our skin is full of pigmentation, and we are able to solve this problem with this device.
Speaking of pigmentation, what are the risks of post-inflammatory hyperpigmentation with a device like this?
Yes, to tell the truth, nothing. We don't have any risks. Yes, because usually we treat pigmentation with lasers, with the Q-switched laser that is considered nowadays the best treatment, but it's not an easy laser to use. And sometimes I saw many complications because many doctors want to solve the problem immediately, and then we have an inflammatory reaction and redness and hyperpigmentation, and sometimes we have a downtime that is very, very long. We are talking about weeks. With this device, always because we are working only in the superficial layer, the downtime is very short and we don't have any risk of inflammatory reaction or hyperpigmentation.
Wonderful. And when you're treating a full face and neck for rejuvenation, are you noticing a complete sort of global improvement in the skin whereby, you know, it's a combination of the pigment lightening, the skin tightening, the wrinkles reducing, and an overall freshness of the skin? Is that what you would treat a full face and neck for? Is that the indication?
Yes. Look, we always see results when we use this device. Of course, the quality of our results depends by many factors. For example, depends by the number of sessions. If I do one session instead of 3 sessions, of course, I'm not able to give the same result to our patients.
Right.
The second point is the quality of the skin, the age of the patients. So one thing is to treat a 40 years patient, another thing is to treat a 70 years patient, okay? And the third and last thing is the energy that I'm using every time. So for example, it happens sometimes that we have patients that want to have the maximum result, but in a very short time. So in these days, we will use a very high energy, and maybe we will do just 1 session or 2 sessions. And they don't mind, they are not worried about the downtime period. At the opposite, sometimes we have patients that they are very afraid of the recovery time, and they tell us, look, I prefer to do 1 session more, 2 sessions more, but very important not to use a very high energy because they want to have a very short downtime period. So a very good thing of this device is that every time we can decide how modulate the energy. And this is very important.
And that would be very important as well. Tell us about the different Fitzpatrick scales. Would you have to spread out the treatments, do a lower energy and more treatments for a higher Fitzpat, so somebody who has darker skin type versus a lighter skin type, or does that have no impact on the treatment at all?
Usually when we are using any kind of device, so lasers or radio frequency or ultrasounds or IFU and something like this, usually there is a rule that when I have, for example, a phototype 1 or 2, usually I can use more energy. When the skin is very dark, so if I have a phototype 3 or 4, usually I need to use a low energy. This is the classical rule.
Yes.
But with the yeast, we don't have this kind of problem. So we can use the same energy with phototype 1, 2, 3, 4. The only limit can be phototype 5 and 6. Phototype 5 and 6 in Italy are not so common. So to tell the truth, we don't have a lot of experience using this device with phototype 5 and 6. Usually people from South America and USA, they have a lot of experience with this kind of phototype. From my point of view, phototype 5 and 6 is a little bit risky. So I think it's possible to treat them without any problem. But at the first time, we need to start with very low energy, see how the react, and then we can improve the level of energy.
This is so exciting. Like, what's the future of this technology? I mean, can we treat body? Can we treat, other types of concerns? What do you see the future of this technology to be?
Yes, I think that this device is always improving the quality, because when I started to use this device, I think it was 7 or 8 years ago. At that time we didn't have the East HP. We had only the first version of East, and the name was only East, but it wasn't so powerful like the device that we are using now. So we are doing a lot of studies about this device. So I think that in the future, we will have a new device, more powerful, and I think we will be able to treat the body in a better way. And another thing is that we are studying is to start to use the device under the skin, not only on the surface. So we have a sort of very small fiber that we can insert under the skin to be able to do a skin tightening, not only from outside, but from inside too at the same time, like an endolift or like the radio frequency subdermal. So we are studying and thinking about how to develop this important device. But I think that in the future, we will have this possibility too.
Wow, you've just blown my mind. So you're thinking about a possibility where you insert the device internally and then obviously use it. Oh, yes, my goodness.
Yes, of course. Now, at the moment, we are using sterile needles that we change, of course, every time in treatment and in every patient. And these needles are very, very thin. But our idea is to develop a very thin fiber. Of course, the length of the fiber will be longer. So we are thinking about using 10 centimeters fiber. And the idea is to insert this small and thin fiber under the skin to be able to have a skin tightening, a skin retraction from inside. So we will be able to combine the two techniques from inside and from outside at the same time.
That is incredible. I cannot wait to hear what you develop and what the future brings for this device. You are full of the most amazing information, Dr. Guido. Today has been just such a special episode, and we would love you to come back to tell us a little bit more about how you use this technology in combination with other treatments as well, and just give us the benefit of your knowledge. So I'd like to thank you so much today for joining us. It's been a real pleasure.
Thank you to you. It was really a pleasure to talk to you.
You've reached the end of another episode of the Beauté by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.